Hi, everybody. Jay with Somnilopod here. I wanted to talk to those of you who are new users to a therapy for a sleep disorder called obstructive sleep apnea. That therapy is called CPAP. Stands for continuous positive airway pressure, and it can take a little bit of getting used to. So to give viewers some background, obstructive sleep apnea is a disorder that causes a closure of the upper airway when we go to sleep. And in some patients, we prescribe them a device called CPAP that is a mask that's worn on the nose, sometimes over the nose and the mouth, that blows room air in through the mask to help keep the airway open. So you can imagine strapping this mask to your face every night before you go to bed, and the thought of that being a long term therapy, which means that it's probably going to be the rest of your life that you will be wearing this, can be a little daunting to some people. So, there are a few things that you can do to try to help yourself get used to the use of the CPAP therapy. One of the main things that we like to point out to people is that consistent use is what's going to make the therapy effective. Now, in order to build up to consistent use, some people simply have to use the device a little bit less. So, for example, it's your first night with your CPAP unit. They have done all of the mask fit, they've got something that's comfortable for you. You've been set up with a unit, you've got it at your bedside. You turn the unit on, you're trying to go to sleep, and you just simply can't. It just feels too weird. So, one of the things we recommend is systematic desensitization. It's a big word that just means get that unit out of the bedroom. Take it into the living room or into the kitchen or wherever you usually sit in the evening just to relax and wind down. And over the next few nights, hold the mask to your face. You don't necessarily need to strap it on with the headgear, especially if you're claustrophobic and it's making you feel a little uncomfortable. So just hold it to your face and continue to breathe with it. Now, one thing I will tell you, any pressure setting that the doctor has prescribed for you, even though it may be a high setting, it is nothing compared to the atmospheric pressure around you. So when you inhale, just relax and let the air come out naturally. One of the number one things that people point out when they first start using CPAP therapy is that it feels like they can't exhale. So just relax, let that air flow out naturally. If you can just sit with that unit for an hour, 2 hours, whatever the case may be, those first few nights, get those nights under your belt. Get to where you're comfortable with using the CPAP unit, and then take the unit back into the bedroom. Ultimately, the goal is to get you using the unit at least 70% of the time. And that's the number that most insurance companies and most physicians feel is quote unquote compliant with therapy. But ultimately, anytime you're sleeping, you have the chance to have sleep apnea. So you really want to be wearing your CPAP unit as much as you can whenever you're sleeping. I hope this has been helpful for you. Please check out some other information at the companion podcast, Somnilopod. You can also contact me through the comments. Hit that like button if you would. I would really appreciate that. That helps get the word out to everybody else so that they can benefit from some of this information as well. So until we talk next time, take care.